Hi, can I come in? Hi, my name is Robin. I'm your student nurse assistant for today. I'm here to give you a bath. Is that okay? We're just gonna wash the upper body. You just check your ID. Hi, Miss Ayala. How are you doing today?
Good, and you?
I'm doing pretty well, thanks. Okay, so I'm gonna close the curtain. I'm gonna lift you up. So one of the first things I'm gonna do is I'm gonna put this bath blanket over you so we can keep you warm but not get your sheets all wet, okay? Because we don't wanna have to change the sheets too.
How high can this thing go?
Pretty high. I mean, my son's up like this. I mean, it's probably at its just about its minimum right now, or maximum.
Can I see how high I can go?
Yeah, in a minute.
Oh.
All right, so it's just like when we were doing the sideline position. Okay, we're gonna have, can you hold that for me? Great. All right. Okay, now I'm gonna put the side rail back up really quick. And then I'm going to get some warm water, okay? 2 washes.
It's not too hot.
Not too hot, okay? So turn over around. You want to feel this for me? Let me know if it's okay.
Oh, that's good, honey.
Okay, great. Okay, both washcloths in. First pair of gloves. Oops, wait. Side roll down. Excuse me.
I thought we were missing somebody and I realized she's in the bed. I was like,
All right.
where is she?
So the first thing we're going to do is we're going to do the face. I want to show you this because when you're doing the skill for the Red Cross, whenever you're bathing, you have to use a clean part of the washcloth for each stroke. Okay? So some places you see them make a little mitt like this. Where you go like this and you wrap it around your hand and then you tuck it in here and now you got a mitt and you go like this.
Okay.
I lose track.
Yeah.
I lose track of what side I've used. So I found it easier to do the peel method where you fold it in half and then fold it in half and you put this corner in the palm of your hand and kind of put your pinky and your thumb around it. And this way you can wipe,
Fold down.
peel, wipe, peel, wipe, okay?
Oh, good.
Much easier. Okay? So the first thing we're gonna do is I'm gonna wash your face. Do you use soap on your face? You're gonna say no. Okay, great. Okay, so we're gonna come across the forehead and down to the ear, and then we're gonna peel. And then we're gonna go from the corner to the eye out to the ear. And then we go across the nose to down to her neck, and then one more, and we're gonna go across her chin and down to her neck. Okay? And we don't have to rinse it because we did not use soap.
Okay.
So then we're just gonna pat it dry. Okay. Now, we're going to get our soap, put our soap on, and then we're going to do her arm. Okay, so I'm going to move this out of the way, and I'm going to put the barrier under her arm. Not totally under her arm, but at least under her hand, and I'll show you why here in just a minute. There you go. Okay, so I have the soap. So now I'm going to do from the shoulder down to her wrist, and I'm going to peel, and I'm going to do the inside of her arm down to the wrist. And I'm going to lift it up, and I'm going to do the back side of her arm down to the wrist. And for the last one, I'm going to do her underarm. Okay? I'm not going to put this back in the water because I don't want to make the water cloudy or cold. Okay? And then you're going to rinse it, doing the same thing. Okay? Now, I'm going to wash her hand with the soapy washcloth. Put the washcloth over here. And then I'm just gonna have her kind of put her hand into the water and I'm gonna rinse it. Okay? Okay, and at this point, I would say, I would change the water if it became cloudy or cool. Okay, and then we're going to put this over the top. And then we're gonna pull down the bath blanket.
Wait, am I naked?
Yes.
Price decency.
Exactly, see, so that keep you covered, right? Okay, so now I have, get the soap one wet again. You notice I just kind of squeezed more water on it, I didn't actually dip it in. Okay, so now we have soap again, and I'm gonna lower this a little bit, and then I'm gonna go across the top of her chest. And then I'm gonna lift it up only enough that I can see what I'm doing, and I'm gonna go across the top of her breast. Okay? And what we're gonna say, because you may have a guy, you may have a girl, okay? It depends. You're going to verbalize that if this were a woman, I would take the back of my hand and lift the breast and clean under the breast.
Okay.
Okay, but use the back of the hand like this.
Yes,
Don't
yes,
grab it.
Right.
Okay?
Okay.
I just went out on YouTube.
Find
That
it
way.
in
Okay.
No. Huh? Okay, and then we're gonna go across the stomach, okay? And then we're gonna put this over here and we're gonna rinse the same way that we washed. Cross, cross. Lift the breast, clean, rinse under the breast, and then across the stomach, okay? And then we're gonna pat dry. We're gonna cover her back up and remove the towel. Carefully. There we go. Okay, and before anything goes into the laundry hamper or the trash, you're gonna say to the evaluator, and I would do the same thing to the other side. Okay? If the evaluator says, okay, show me, we're going to remove our gloves. Okay, put the side rail up. And then we're gonna take both of our washcloths and we're gonna verbalize. I'm going to change the water and rinse the washcloths. Okay, and then you're gonna come back again and ask her, is that okay? And then you're gonna go around to the other side and do exactly the same thing. Okay, that's why we keep an extra pair of gloves in our pocket just in case. Okay, but this time the evaluator said, no, you're good. So these go into the laundry hamper. It's over there somewhere. Okay, I'm going to dump this. Soap, trash. Okay, this is her personal stuff. Go in the trash.
Have any hair dye?
So now I'm going to put this back down. Pull the sheet up over her. Can you hold on to that? And then we're going to remove the bath blanket. Hold it away from you. Goes into the laundry hamper. The laundry hamper needs to be closer because I just left her in a very unsafe
Yes.
position
Right.
to go over there. Okay, so then we're going to do our ABCs. All right, I'm gonna go down to the end there and check her alignment. Okay. So her nose needs